New videos every day. Life, wisdom. Psychetruth, massage.
This is Athena Jezik, and today we have a new model, Heather. We're going to work on the neck and shoulders and face right off the bat. But I wanted to just talk for a few minutes, and one is ask a question about how many of you find these videos very relaxing, that you use them to take away your stress or to even fall asleep with. Not that it matters. If my job wasn't about getting people relaxed, it would be very offensive that so many of your comments are that you fall asleep in the videos. But that's exactly what we want you to do, really, because that's what your body needs. So if you would comment on what these videos do for you when you're watching them, if they make you sleepy, if they feel like you're relaxing more down, if they make you feel like your heart rate slows down, if you just feel good overall, just let us know in the comments if you would, so we can better understand our audience. Thank you. Now we will start. If I can get off this stool. Okay, you start by bringing the hair up. That's what we're going to start today. And I always pull the hair up under this way, as you've seen. I know that a lot of these videos seem to repeat themselves, but that's what this kind of work is about. It's about finding a system that works and then basically following a particular protocol and modifying it if there's something that you find in someone's body that needs a little different attention. We're going to start by putting the oil on the neck. And I'm just going to put the oil on now on the upper chest. I know in some massage schools and all that, it is a good idea to just maintain contact with your person, but it's pretty hard for me to do that in this setting because I don't have my oil like I usually do. And I just don't worry about that anymore since I don't really do massage therapy. Now, with very light amount of oil still left on my hands, I'm going to use this on her face so that we just get a little slip. We don't need a lot, but we do need some. Okay. So basically I do the same things. I'm stretching the neck here from the fingers underneath. But I might change it up a little bit just to show you that you can change things a little. That's where the part comes in, where you're basically following the same protocol, but you can change it up just a little. You almost need to change it up a little because after you work, 7 or 8 bodies a day, and you're doing that several days a week, the job can get a little bit monotonous. So it's good to change it up a little bit, even though each person is very different and brings something different to the table, no pun intended. It still becomes, it's just work, and work is work, and we all understand that. So the ideal job is not always so ideal once you get into the real journey of the job. So you have to love it. You have to love what you do. Okay. So I'm going to do a little bit of an occipital base release because there seems to be some tension in the upper back and neck. So this is the cranial technique right at the base of the skull. If you're wanting to know more about this, you can check on the cranial. I think I explained it on some of the cranial videos. And we'll just wait for it to release, which may take a little while. What you're going to feel under your fingers when you're in this position is, first of all, you're not on the bone. You're just dropped below the bone. Fingers are pointing toward the eyes. You're not pushing into the neck. You're just letting the weight of the head and neck be on your fingers. And you're not really holding the head. You're maybe balancing it so it won't flop around, but you're not holding the head with the palm of the hands. And you just wait for that head to drop. The chin will lift a little bit as it drops. And we can go under that one again. I think I can take her. You can sometimes take people up pretty high. As this tissue softens, the neck feels quite restricted at first when there's a lot of tension in the neck and you can't get the head up very high. You start up by dropping that chin before you drop. Put your fingers in place, and then there it goes, much deeper. What you're going to feel with your fingers is that you're going almost underneath the skull, but you don't push. You just allow it to rest there until it opens up and relaxes on its own. If you push, you're just going to fight it. You're not going to get any kind of release of any significance. More than likely, you'll just bring the muscles into a muscle failure situation. And then once they regain their chemistry, they'll come back just like they were. So now that we've done that, the neck is much softer all through here. The trapezius where it's attaching in, much, much softer to work. And even the shoulders are quite a bit softer. So the work is going to be easier already with just that amount of release. So it doesn't take much. That's why we don't always have to use a lot of force into the body. And as a cranial sacral person, I'm not a proponent of a force at all, although I do know that sometimes it may be necessary. And some people may like it, which is a fine choice, but I find that the results are far exceeding anything when less force is used. So experiment with that, especially if you're a body worker. Well, that's a little catch there. Is that okay? Okay. We'll move up and we'll do a little bit on the chin. I'm going to do mostly muscle work. When you do the lymphatic work on the chin, you're pumping, stretching the skin in a more pumping action. Now here everything moves upward, following the bone line to the chin. You can also pluck a little bit. Just kind of pull the skin a little bit up, relaxing the tissues. Under the eyes, just sweep around the eyes. Now there's not a lot of pressure here, but you're definitely feeling that you're into the little musculature that's there in the face. It's not a big muscles. They're fairly flat. Your jaw and neck gets a little different, but so you want to be gentle, and yet just with enough firmness to do something. You don't want to be necessarily feather soft and tickly, at least for this kind of work. And we're lifting up the nasal bones here. This is good for congestion. Oftentimes we'll open up people's sinuses a little bit, the frontal sinus, and sinuses around the eyes. It's a positional thing. You're just pulling the nasal bones, decompressing them a little bit. So you can play with that. You don't squeeze hard on the bridge of the nose. It's a melding in. You just feel like you're a magnetic, two magnets that have come together, and with that kind of magnetic or energetic pull that you're holding, then you lift the nasal bones upward. And then you can Now the nose is coming down, but then you're going to take the skin, the rest of it up. Okay, you can go around the ears gently. Some people really rip into the ears. If you ever have a client who's flinching a little bit, you should up on them, because it's their way of letting you know that it's not comfortable. Okay, and now we can smooth down. So from here, what we're going to do today is just work everything together, both sides, and work through this anterior part of the shoulder. Some attachments in there. Just feel the quality of the muscle. If it's smooth, if it's washboardy, if it's pushing you back, if it's real loose. You want a certain amount of tension in the muscles. You don't want them to be real lazy. And it all feels real smooth through here. There's a little bit right as you come to the shoulder blade. Almost everybody has that going on. That's the muscle that lifts the shoulders up to the ears. It does carry a lot of stress. For some reason, I guess we feel when we're stressed, if we hold our shoulders up, we'll be able to walk better. But it's really better if we just relax and let those shoulders swing, be floated up on the rib cage. If you think the rib cage is kind of like there's oxygen, the lungs are oxygen. It's like we're air, floating in air, sort of. We have a structure, but all the shoulder girdle should be relaxed on top of that buoyancy of the rib cage, and the stability part should be coming in from your center. And just work into it like that. This all feels pretty good. The work, when you release with the cranial release, if it's done properly, a lot of the work is a lot easier. Things are relaxed out, and there's just not as much work to do. Now down here about C7, it oftentimes feels real good to just get your thumbs in there and stretch it, going into the tissue, not too far, but just letting it invite you in a ways and then stretching it out. It's just a really nice feeling right there at C7 and moving up into the lower cervical vertebrae, and maybe even down a little bit to the upper T vertebrae, just right there where the top of the, right because the neck begins at the base of the neck. Okay. So with that, you can do a little on the head. As you can see, I was moving around a little differently, but still moving from one group to the other, so it's not feeling too broken. You don't want your massages to feel broken. I know I've had some work done on me where somebody would work my foot and then they'd jump up to my upper thigh and then they'd jump back down to my low leg, and that was really unpleasant. It wasn't very relaxing. It was kind of chaotic, actually. So learning to move from one muscle group to the other, even if you're doing piecemeal work like we're doing today, and then check the range of motion. Setting the head down and making sure it's centered. There we are. So with that, let me know in the comments if you fall asleep or if you fell asleep with this video. I welcome your comments, and you can check me out more on my website at acranio.com or athenajezikmassage.com. Thank you so much for watching.